Hello everyone, welcome to the series on dental anatomy. In today's video, we will discuss about permanent maxillary lateral incisor, its chronology, dimensions and morphology. But before moving forward, let's have a quick introduction of the tooth. The permanent maxillary lateral incisor are two in number, one on each side of the maxillary arch. They are positioned lateral to the central incisor and mesial to the canine, that is, their position is lateral to central incisor and mesial to canine. Similar to all other incisor, their primary function is to cut or slice the food. Cut or slice food into small chewable parts. They are also essential for proper speech, that is clear articulation of words, and a good facial aesthetics. As per the FDI system of notation, they are denoted as 1-2 and 2-2, where 1-2 represents upper right lateral incisor and 2-2 represents upper left lateral incisor. In the universal notation system, we use the numbers 7 and 10 to represent upper right lateral incisor and upper left lateral incisor. And in the Sigmondi-Palmer system of notation, these are designated using the symbol 2-2 or 2-2 for right and left lateral incisor respectively. Now coming to the chronology. Permanent maxillary lateral incisor erupts at the age of 8 to 9 years. It is the fifth permanent tooth in the eruption sequence after first molars and lower lateral incisors that erupts at 6 to 7 years and upper central and lower lateral incisor that erupts at 7 to 8 years. The first evidence of calcification is seen at 10 to 12 months. The crown formation is completed by 4 to 5 years and the root is completed by 11 years. Next we will look into the dimensions of the tooth. The overall length of permanent maxillary lateral incisor is around 22 mm, of which the crown length is 9 mm and the root measures 13 mm. The mesiodistal diameter of crown is 6.5 mm at the crest of curvature and 5 mm at the cervix. The labiolingual diameter is 6 mm at the crest of curvature and 5 mm at the cervix. Lastly, the curvature of the cervical line. It is 3 mm on the mesial side and 2 mm on the distal side. Now let's understand the surfaces, line angles and point angles. The permanent maxillary lateral incisor have 4 surfaces and 1 incisal ridge. The surfaces include labial, lingual, mesial and distal surfaces. The incisal ridge with time changes to a surface due to continuous occlusal wear and is also referred as incisal surface in several textbooks. The lateral incisor have 6 line angles which include mesiolabial, distolabial, mesiolingual, distolingual, labioincisal and linguoincisal. That is, mesiolabial between the mesial and labial surface, distolabial between the distal and labial surface, mesiolingual between the mesial and lingual surface, distolingual between the distal and lingual surface, labioincisal between the labial and incisal surface, and linguoincisal between the lingual and incisal surface. There are 4 point angles. These include mesiolabioincisal between the mesial, labial and incisal surface, mesiolinguoincisal between the mesial, lingual and incisal surface, distolabioincisal between the distal, labial and incisal surface, and distolinguoincisal between the distal, lingual and incisal surface. Now let's study the tooth morphology in detail from different aspects, starting with the labial aspect. The crown surface is smooth and the outline is trapezoidal in shape. The tooth appears similar to permanent maxillary central incisor, but it presents more curvatures when compared to the central incisor and have rounded incisal ridge and incisal angles when compared to the central incisors. Also, the crown is smaller in all dimensions when compared to the central incisor. The mesial outline is almost straight, similar to the central incisor, with a more rounded mesio-incisal angle. The crest of curvature is usually at the junction of middle and incisal third. The distal outline is more rounded and shorter than the mesial outline, and the disto-incisal angle is more rounded as compared to the mesio-incisal angle. The crest of contour is more cervical, usually at the middle of the middle third. The incisal outline formed by the incisal ridge is relatively straight in the mesial half and rounded in the distal half. The cervical outline is convex towards the apex and the curvature is more than that seen in the central incisor. All these features that we have seen on the labial aspect are very important for proper tooth identification and site determination. So, if we compare permanent maxillary lateral incisor and permanent maxillary central incisor, we know that the lateral incisor is smaller in size and has more curved outlines as compared to the central incisor. Its incisal ridge is round in the distal half while it is straight in central incisor, and the mesio-incisal and disto-incisal angles are more rounded in lateral incisor. Next, if we have to distinguish between mesial and distal side of the lateral incisor, the mesial outline is straight while the distal outline is rounded. The mesio-incisal angle is less rounded while the disto-incisal angle is more rounded. So these features helps in easy identification and site determination of the tooth. Now moving on to the lingual aspect of the tooth. The crown outline is similar to that seen from the labial aspect. That is, crown outline same as labial aspect. It is trapezoidal in shape with straight mesial outline, convex distal outline. The incisal outline is straight in the mesial half and rounded in the distal half, and the cervical outline is curved in the apical direction. However, the lingual aspect presents important features which includes the cingulum, mesial marginal ridge and distal marginal ridge, the lingual fossa, and developmental grooves. The cingulum, present in the cervical third of the crown, is more prominent than that seen on the central incisor, and it has a tendency towards deep developmental groove where it joins the lingual fossa. That is, developmental grooves can be found at the junction of cingulum and the lingual fossa. Also, a deep developmental groove can be found on the distal side of the cingulum, and it extends to varying length on the root. These developmental grooves are the places where enamel defects are commonly seen. The mesial marginal ridge and distal marginal ridge are also prominent, and the lingo-incisal ridge is also well developed. The lingual fossa is more concave and circumscribed than that found on the central incisor. Now coming to the mesial aspect. The crown appears triangular in shape and is similar to the mesial aspect of central incisor. Also, similar to central incisor, the incisal ridge of lateral incisor is in line with the center of the root. That is, if we draw a line through the center of the tooth, it will bisect the incisal ridge and the root apex. This feature is characteristic of both permanent maxillary central and lateral incisors. The key points that differentiate permanent maxillary lateral incisor from permanent maxillary central incisor include a shorter crown length, relatively longer root, relatively longer root. The labiolingual width is 1 mm or so less when compared to the central incisor, and the incisal ridge appears thicker in lateral incisor. Similar to the central incisor, the labial outline is convex with maximum convexity in the cervical portion and slight convexity between cervical third and incisal ridge. The lingual outline is also convex in the cervical third and then follows a slightly concave and straight path towards the incisal ridge. The crest of curvature of labial and lingual outlines is present in the cervical portion just coronal to the cervical line. The incisal outline formed by the incisal ridge is round in shape, and the cervical outline formed by the cemento-enamel junction shows marked curvature in an incisal direction. Coming to the distal aspect of the crown, it is wedge-shaped or triangular in outline, similar to the mesial side. The labial outline is convex with maximum convexity at the cervical portion and less convexity towards the incisal ridge. The lingual outline presents convexity opposite to the cingulum, followed by slight concavity and then a straight path towards the incisal ridge. The incisal outline is rounded and the cervical outline is curved in a coronal direction. The key differences between mesial and distal aspects of the lateral incisor include: number 1, the curvature of cervical line. Curvature of cervical line. It is 1 mm less on distal side. As we had discussed earlier, the curvature of cervical line on mesial side is 3 mm and on distal side it is 2 mm. On distal side it is 2 mm. The second point is crown appears thicker from the distal aspect. Next, a palatogingival or palatoradicular developmental groove can be found on the distal side of the crown. And the last point of difference is the location of the contact area. On the distal side, it is at the center of middle third of the crown, while on the mesial side, it is at the junction of incisal and middle third of the crown. Now moving on to the incisal aspect. The incisal aspect of permanent maxillary lateral incisor may resemble the incisal aspect of central incisor, appearing triangular in shape, or it may resemble the incisal aspect of a small canine, in which case the outline will be oval in shape. From the incisal aspect, the mesiodistal dimension is slightly more than the labiolingual dimension. The labial outline of the crown is more convex than that of the central incisor. Similarly, the lingual outline also appears more convex than that seen on the central incisor. An important point to note here is that the line bisecting the incisal ridge in mesiodistal direction is always straight, and it bisects the short arches representing mesial and distal contact areas. So that was all about permanent maxillary lateral incisor. But keep in mind, the permanent maxillary lateral incisor shows the most variation among all permanent teeth except the third molars. The morphological features that we discussed today are typical one and commonly found in human dentition. For more details about the variations seen in permanent maxillary lateral incisor, you can check out our dental anatomy notes on the MedicalSutras app. In the upcoming video, we will discuss about permanent mandibular lateral incisor. Till then, if you found the video helpful and informative, then do like the video, share it with your friends, and subscribe the channel for more such content.